Hey, Suzanne here with caregiverhaven.com. So we have some really great questions from our members. And again, it's all about medications this month. That's what we're talking about, because if we get medications right, we're going to have safe, happy, and the longevity is going to be great for our seniors. We've got to get the medications right first. And if we don't, what happens is everything else we can't seem to just click in the process of caregiving without looking at medications first. They are that important. 77% of all medical errors are based on medications. So we want our seniors safe on these drugs. And that's why we're spending a whole month just on medications. All right, so our first question today, thank you for sending them in, is my mom is taking Advil when she needs it, which is basically every day. And lately she's had stomach issues, she stopped eating, and she's bruising more. She refuses to stop because she says she can't function with the pain anymore. She's also on blood pressure meds and something for her heart. And I'm worried we're playing with fire. What's actually safer for her, Advil or Tylenol? And this is from Pam in Oregon. Pam, you are not wrong to ask this question. You know, I love ibuprofen or Advil. I think it's a great pain medication. And a lot of people will say Tylenol doesn't work, but Tylenol does work. It does work. But back to the Advil, you got to take it right. You got to take both of these medications correctly in order to protect, especially NSAIDs, to protect that stomach. Working in the emergency room, I've seen the stomach starts bleeding. When it bleeds, blood in the stomach causes nauseousness. And the seniors come in, they feel nauseous, they're not eating anymore. We're looking at their pain meds, and then oftentimes the caregiver forgets to tell me. I have to ask specifically, are they taking Advil or ibuprofen or naproxen? How often? And they tell me. And then the first thing, my alarms go up and I start thinking surgery, they've got a bleed. We've got to look and see if they have a bleed, because this is typical for seniors that take these drugs every day. All right. So what we're going to do is learn a little bit about the NSAIDs and acetaminophen. All right. NSAID stands for non-steroidal anti-inflammatory drugs. Non-steroidal, they're not steroids. All right. But they are anti-inflammatory, so they take down the pain. And they do the same thing that acetaminophen does. I think I'm going to sneeze. All right. Sorry. Acetaminophen, Tylenol, right? So Tylenol takes down the pain, but NSAIDs also raise the risk of a stomach bleed in older adults. So we have to look at that. And I wouldn't wait another moment, Pam, if I were you. I would get my mom checked out by the doctor. She's at high risk of a bleed. She's also, you said, on heart medicine, so I don't know if that's a blood thinner or not. NSAIDs also have an effect on the kidneys, so I just don't know what's going on. So she needs to get to her doctor, and we need to see if she's going to get better if she gets off this Advil. We don't want to risk a bleed, and we want to know if she's already got one. That's the question I would ask. That's the mental gymnastics I do as I'm talking to my patients, is I would do this mental gymnastics. What's the cause here? What's going on? What could change it? And the first thing I look at always are the medications. So also, but you can watch for red flags like black stools. Black stools are an internal bleeding. The stomach pain could be the Advil. The safe way to take it is with food. You always have to drop food. I don't care if it's 2 or 3 crackers. You got to drop something in your stomach, not coffee, not tea. It's got to be a food. So the pills land on the food, not the stomach lining, because it eats the stomach lining away, and then the stomach fills up with blood. Swelling of the stomach too, or a sudden blood pressure changes. That means they're bleeding out. They're losing blood. And I'm telling you, that's a hard thing to fix. All right. Very dangerous. That's what we'd see in the emergency room. We move fast. We move fast on these people. But many times caregivers would come in and say to the receptionist at the emergency room, oh, their stomach hurts. No, I need more than that. I need to know. You need to tell the receptionist at the front desk at the emergency room, they're on Advil, they're not feeling well, they're bruising, they're nauseous, they're all of this stuff. And you know what? Blood pressure's tanking. They're in the back immediately. All right. Ask about arthritis pain relief for seniors that's safer than the NSAIDs. All right. Now, also too, Tylenol is deemed safer, and she can take the Tylenol. Just know that the Tylenol works on the liver. All right. So if she has any liver problems, the doctor has to determine whether she can take Tylenol. You can't just reach this stuff over the counter. You've really got to ask if it's okay, and especially if she's taking it with other medications. And that's what the pharmacist is for. Just because you picked it up over the counter, you got to walk over to the pharmacy counter and you got to say, I need to speak to a pharmacist, especially somebody who has a whole list. And if you have the whole list in your pocket, you should pull that out, not on your phone. I'm talking about keep it in your wallet, a whole list of all the medications and why she is taking them. Okay. And then ask the pharmacist if it's safe to take Tylenol or Advil. Advil, I'm not a fan of, because I've seen too many stomach bleeds in my practice, in my emergency rooms. All right. Dad takes Tylenol. The second question. Dad takes Tylenol and then takes a cold medicine and then takes a PM at night. Oh my gosh. So what we're talking about here is Tylenol PM or Advil PM. Okay. I realized multiple bottles contain acetaminophen and he has no idea. He says, I'm not taking that much. I'm starting at labels. I'm staring at labels like it's a math test. And the simple rule is he doesn't know that he's taking all this acetaminophen. All right. This is from Jordan in South Carolina. Jordan, this is called medication stacking. All right. So what it means is that your dad is doing a perfect stacking here. So he's taking a medication for sleep. He's taking another medication, another medication, another medication. And he doesn't realize that all 4, 5, 6 medications have acetaminophen in them. So a little bit, a little bit, a little bit, a little bit. Well, they all add up. And can Tylenol be toxic? Sure. I've seen people in the emergency room. I've seen them overdose on acetaminophen. So we got to ask a question, is he toxic? Is he overdosing on it? And that's a question. You're going to walk over to the pharmacy and you're going to say to the pharmacist, I need you to look at all these medications. And what am I going to use instead for his pain that he has? Okay. That is a very common question. And that is something we have seen over and over. And I love education because giving you this educational value is going to help you save your parent and just from surgery and disaster. So teach the same ingredient rule. Acetaminophen overdose risk is hidden in these multiple symptom cold meds. You know, he may say, I only take a cold medicine once in a while, or I only take an allergy medicine once in a while. It adds up. It adds up. Some of these medications are water-based. And if they're water-based, like vitamin C and vitamin B, these are water-based vitamins, which means if you take enough of them, you pee them out. Best way to say it. You just pee them out. All right. But something like, we call it DECA, because it's vitamin D, vitamin A, vitamin K, vitamin D, vitamin E, vitamin K, and vitamin A. All right. DECA, D-E-K-A. Those 4 vitamins are toxic. They build up and are stored in our fatty tissues. And we do have fatty tissue. Everybody does. So they store up. And I've seen patients that have overdosed on these because they kept taking them. And they were in all their other medications too. And the next thing you know, people are in my emergency room with DECA toxicity, one of the 4 vitamins. All right. So we have to know is what other drugs are holding acetaminophen longer than it should be. So is it building up? Is there a building up of toxicity? You have to ask the pharmacist about this. So get with the pharmacist and decide on a daily maximum acetaminophen limit that he can have. And then go to the doctor and make sure that the doctor understands this too, especially if he has liver disease or if he's an alcoholic. And I mean alcohol use. I shouldn't say alcoholic, but if he does drink a lot of alcohol, that affects the liver, right? So any kind of damage to the liver is not going to be able to process it. Guess what? It stores up, 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 up. It's going to get higher and higher and higher and higher because and then he's going to get toxic on the acetaminophen. So don't want to do that. So check this medication stacking. He's taking A lot of different medications, but they all have the acetaminophen in them. Best thing is to use one pharmacy, but many times pharmacies charge different prices for stuff. So I'm a true believer in shopping around to have savings on your medications, but I'm still a proponent of finding one pharmacist you trust, one pharmacist that gets to know you. They ought to know your name. They ought to know your kids. They ought to know where you work. They ought to know that they become your friend, like in the old days, like in the 60s and 70s when we knew our pharmacists. We knew them. And I'd be walking through the front door of the pharmacy and there's Charlie in the back going, "Hey, Suzanne, how are you?" Because they knew me, all right? Because I'd be picking up meds for my parents or whatever it took. They knew me. So get to know your pharmacy. One pharmacist, but you could have multiple pharmacies depending on the cost of drugs. But that's a sidebar. We'll talk about that another time. Anyway, so find this one pharmacist and then go over all the over-the-counter medications and then all the prescription medications so they can check and see if there's any medication stacking going on. And then keep that list of all these medications. I think you're getting the idea here. All right. If this helped, please subscribe to this channel, give it a thumbs up, and share it with somebody who is staring at pills right now. They've got a ton of medications, and you just want to make sure they're not overdosing on any one type of medication that's hidden in the ingredients. All right. In answer, I do like Tylenol. I think it's safer. I know it's safer than the NSAIDs because of the GI bleed. All right. The risk that is there. And then there's acetaminophen overdose. So you got to be careful with that. So ask the pharmacist what's the safest medication. Take care. Talk soon and see you in the next video. Bye.